The following segment is sponsored by Inovia Vein Specialty Centers.
Welcome back to AM Northwest. From varicose veins to pelvic venous disease, women are at increased risk for vein problems. And here to tell us what we need to know, including promising new treatments, we welcome from Inovia Vein Specialty Centers, Dr. Lauren Wikholm. Good to have you with us.
Thank you.
So first of all, May is Women's Month, Women's Health Month, is that right?
Correct. Yes.
Yeah, and the vein issue really affects a lot of women.
That's
women
right.
more than men.
Mm-hmm. Yes, so while a lot of venous reflux problems are genetic in nature, women are at increased risk due to hormonal changes as well as history of pregnancies that increase pressure on the leg veins. And the legs have such long veins, so sometimes I think of it like a stiletto heel, in that there's a lot of pressure on a long skinny vein, and so that's why the legs are more at increased risk of having venous problems.
So the pregnancy you said has to do with, you mentioned hormones, but is it also standing a lot? Is it?
Yes, yeah. So, I mean, all people stand a lot, or most people stand a lot, I would say. So that's where the increase in elasticity and pressure predisposes someone to having stretchier veins. Because when we're talking about venous problems, the most common type of that is called venous reflux, which is the vein has stretched out too much to do its job. And the things that increase that are pressure on the legs, and this could be through pregnancy, literally the baby sitting on the legs and causing more pressure, or increased blood volume during a pregnancy, as well as tall height or even obesity. All of those things increase pressure on the legs, therefore increasing a vein likelihood to get stretched out.
And they're painful, right?
Correct, yeah. So they could, just any tissue that's stretched out, if you imagine if you bumped your knee and it was really swollen, that would be uncomfortable. Same thing when the veins stretch out and are swollen, that can cause pain. And ultimately it can cause swelling in the lower leg.
Right.
Or even skin problems.
And you have something that can help diminish those. Is that correct?
Yeah.
So tell me about that.
Yeah. So the more modern procedures, because the old procedures was called vein stripping, and that's no longer done in the U.S. generally.
Wow.
Because that's an old style and much more painful.
Yes.
The newer techniques are minimally invasive. They have an incision about this big and very small instruments to seal the bad veins closed, which is a little bit like taking out one bad tooth.
Let's take a look at a before and after, and you tell me about the difference. Wow.
Yeah.
That's a big difference because they're unsightly too. Yeah, it's something I know a lot of women have and can't stand them. Yeah. So tell us about this before and after.
So this is a person who had C2 disease, because we consider this on a 1 to 6 scale. So 2 is those larger, bulging, maybe throbbing, usually more painful at the end of the day compared to the morning.
Yeah.
And those can be managed either medically if they're painful, and again through small procedures where you're back with your activities a few days later. Or sometimes we also manage them cosmetically. We kind of tailor that to what the person needs.
Let's take a look at another before and after, and you can tell me.
Yeah.
Again, that's really impressive.
Yeah, so this person is they're similar in that those varicose veins were on the surface.
Right.
Sometimes, I'm not sure if we have a picture of a lower ankle ulcer, but that would be the more severe case of venous reflux.
Wow. How many treatments does it take to achieve something like this in the previous picture?
Honestly, those were probably 1 or 2 treatments.
Oh, wow.
The second photo was probably 1 treatment. The first photo might have been 2 treatments, and they're usually about 20 to 15 minutes in the office.
And spider veins, they're a little less, right?
Correct,
more red.
No incisions for those, yeah.
And you can take care of those easily as well.
Correct.
That's fabulous. People must feel so much better when you're able to get rid of the varicose veins that we just saw.
Yeah.
Like you feel more the ability to be more active.
Yeah, that's one of my favorite things to hear patients say months later, is that their legs are less heavy.
Yeah.
They don't feel as fatigued, because when you have a lot of those varicose veins, it's literally like an ankle weight of extra blood.
Oh, wow.
So if you imagine having like, a 4 to 5 ounce weight that you're carrying all day, your legs are going to feel a lot less fatigued at the end of the day.
Right, and you feel more self-confident when you have that. That's wild. We want to tell everyone, if you'd like to find out more about Inovia Vein Center, we're going to put more information on our website at katu.com/AMNW. Dr. Lauren Wikholm, thank you so much.
Thanks.